Welcome to On the Beat, everyone. I'm Troy Thompson. I'm joined today by neurologist Dr. Hashmat. Now, he's from Monroe Regional Hospital, but today we're talking all about strokes. Welcome to the show, my friend. Nice to see you.
Thank you for having me.
Okay, I want to explain, well, I'd like you to explain at least, what's the difference between a stroke and a heart attack? Because people feel that it's one and the same.
Well, I mean, if you look at the physiology, it's probably the same phenomena, but one is happening in the heart and other in the brain.
Right.
So when a stroke occurs, what happens in stroke, there is a cut off of blood supply to the particular part of the brain. And when a stroke occurs, the cells in the immediate area begins to die because they're no longer receiving nutrition or oxygen, which they need to function. And that's a condition called a stroke.
Okay, are there different types of strokes?
Yes, sir, absolutely. Primarily, there are two types of strokes.
Okay.
One is an ischemic stroke, where a blood clot blocks the blood vessel, or a cholesterol plaque can block the blood vessel and causes a stroke. So almost 80% of the strokes are ischemic stroke. Other type is hemorrhagic stroke, where a blood vessel rupture and blood leaks into the brain. And these kind of strokes are almost like 20% of the time.
Really? So may I ask, do both of those stroke have the same feeling that you are having a stroke coming on? Are the symptoms the same?
Presentation is going to be the same. So what are the presentation or symptoms of the stroke, how a person can know? The distinctive feature of the stroke is a sudden onset. And that's a primary thing. So sudden onset of weakness, numbness, or tingling in one side of the body, including face, arm, or leg. Sudden onset of vision difficulties, sudden onset of speech difficulties or confusion, sudden onset of headache without any prior history of headaches, or things like that. So these are the primary signs and symptoms.
Are they more common in men and women?
It's not. It's more common in women than the men.
Really?
Yeah, because of the risk factors.
Is it hereditary?
There is some hereditary cases are too, but again, it's connected to the risk factors.
Right. High cholesterol, for example,
Exactly.
because you were talking about that's one of the issues when it comes to the first stroke you were talking about. I want to understand, why is it so important when we are having a stroke to get help so fast?
Before I go to the answer, I would like to point out towards the primary risk factors of the stroke.
Yes.
Number one is high blood pressure. Number two is diabetes, high cholesterol, smoking, and the heart condition is called atrial fibrillation. These are the primary risk factors which can lead to the stroke. I'm
3 out of 5 for them.
Well, I'm so sorry then.
My goodness.
So to answer your question, the victims of the stroke can get help. The newer technologies and treatment modalities where blood clot dissolving medication can be provided. It's called TPA. The same thing we have been doing for the heart as well for a long period of time, but now we are doing for the brain as well. So the key is to act fast, because the window, the opportunity time duration is only 3 hours. So a person has to get to the hospital within 60 minutes in order to get that treatment.
Within 60 minutes of having the stroke?
No, 60 minutes you have to get to the hospital, and the stroke team has to evaluate him and do all the investigations. And within 3 hours, that TPA has to be given to the patient.
What's the average of people getting to the hospital and having that?
Not too high in this, especially in our society, in our Mississippi state. It's not very high. Only, I would say, 5 to 10% can get to the hospital
fast enough. And so what happens once you've had the stroke? What are some of the physical issues that you may have, very quickly?
So the primary, the most common is like a weakness or numbness on one side of the body that leads to paralysis or weakness. So primarily, you look into the symptoms and signs.
Many more to come. Thank you so much. We really appreciate you.
Thank you very much.
If you want to find out more information about Dr. Hashmat and Monroe Regional Hospital, there it all is up on the screen.